What is your advice to people considering turning out to protest this weekend?
Look, I think in the light of what we've just heard, I would be very against it. I'm not arguing, the principle of it, Ash. That's fine. That's unarguable, yes. But the practice, can we just do it in another way? We've had a case from the protest in Victoria. Now, almost certainly not related to the protest itself because he got symptomatic the following day, but he could well have been infectious at the time of the protest and infected other people. Yes, he wore a mask, wasn't symptomatic that day, but transmission still possible. So look, it's just not a great time. We're in such a good position nationally elsewhere to do this. So please, could people stay home, register their protest in another way and not go en masse to Langley Park?
Yeah, and you're talking about the Perth protest there planned for this weekend. The Deputy Premier and Health Minister here in WA, Roger Cook, has been put in a slightly awkward position. The front page of the West Australian today talking about how his wife, who is Aboriginal, will be attending that rally. There is an argument, though, we're hearing from some quarters that there isn't really any greater risk attending a protest like that if you're wearing a mask, if you're social distancing, compared with heading to the local shops or sending kids to school. What do you make of people who take that point?
Look, I think there was two big ifs in there when you said it, if you're wearing a mask and if you're social distancing. And we've seen from every other protest right throughout Australia that only a minority of people are wearing masks. The majority of people aren't social distancing. There's a lot of yelling and screaming and aerosolising and things going on as well. So this is not a controlled, orderly protest. So this is potentially something where viruses, not just COVID, but other viruses can be transmitted. And look, we've asked everybody else to do the right thing in terms of staying home, working from home, limited number of people at weddings, funerals, restaurants, bars, everything else. And people have done the right thing in the main very, very well. And now suddenly we've got this explosion of a protest, and it's debatable, I guess, as to whether it should go ahead or not. But my feeling is that it shouldn't, not in large numbers anyway. And there are lots of other ways that people can voice their protests other than marching up and down or gathering en masse anywhere in Australia. So it's just not a good idea. I'm totally with the Prime Minister and the Premier on this one.
And Clay, we've seen this be a big issue in Canberra the last couple of days. There are two Green senators who attended that Melbourne protest who say they're not going to get tested, they're going to stay there at Parliament House, and only if they get symptoms will they go and get tested. Labor took a different approach. All four Labor MPs who did attend the protests last weekend have had coronavirus tests. Those results have come back today. They've all tested negative. That's not surprising though, is it? I mean, being tested just 5 days after attending the rally would probably be too early for a positive test result to show up, wouldn't it?
It may be too early. And of course, as we know, the risk of coronavirus in Australia now is very, very low. Now, I acknowledge that, and that's one of the many reasons why we should open the borders. But opening the borders is very, very different to mass gatherings, totally different set of situations. So to answer your question, 5 days may be early. The chances of getting infected at the protest still remain low because we know the community incidence of COVID in Victoria and New South Wales is about 0.002%, so it's very low. So it can still happen. It's unlikely you're going to get infected, but it does not take away the principle that we just shouldn't do it. And look, I think if you do get symptomatic, no-brainer, you should go and get tested. I'm not kind of in the belief that if you're completely asymptomatic that you should go and have a test, and that's the position that the Chief Medical Officer has taken as well. The AMA have taken a slightly different approach to that, but I would be tested if you get symptoms, but not if you're asymptomatic. So I'm not railing about that one. What I'm railing about is people going in the first place.
And when we talk about people who are asymptomatic, I know that you have been looking at a really interesting study that was done on asymptomatic cases on a cruise ship. Just take us through the findings of that results. What did it reveal and why did you find it so interesting?
Look, it was a fascinating study. You may remember a couple of months ago there was a luxury small cruise ship called the Greg Mortimer. Now, this is a new ship. It's a suite-only ship, limited number of passengers, crew housed in very, very good accommodation. I think it was $53,000 per person for the 21-day cruise, exclusive of airfare. So you can imagine how good it was. And then, of course, they got COVID-19 on board the ship, tried to go back to Chile, Argentina, got turned away, ended up in Uruguay, and a lot of people got sick on the ship, and a passenger died, and several others went to intensive care and to hospital. So what they did in this study, they tested everybody on board, all passengers and all crew. So 271 passengers and crew, and staggeringly 2/3 of them were positive for COVID-19, even despite the fact they were in fantastic surroundings and not kind of crammed together in maybe a cheaper cruise liner with 3,000 people on board. But also the other staggering thing was, of those people that were positive, 80% of them were asymptomatic. So it really looks at the whole cruise industry and says, wow, incredibly high asymptomatic rate and incredibly high transmission rate on a luxury small boat. So it does really sound the alarm for ongoing cruising in this current environment of COVID-19. And certainly I would recommend to anybody, don't go on an international cruise anytime soon while the world situation is still so dire.
Just finally, I know you've been working a lot on how the sporting codes are handling the risk. We know that plenty of people are looking forward to the footy happening tonight. There are going to be these special hubs in place, as we know, along with strong testing regimes to keep the players safe. Are all the extreme measures that the AFL, for example, is taking, are they even necessary at this point, or could they be further relaxed, do you think?
Look, what the AFL's done has been fantastic. They have taken it beyond next level. So to outline this program, they are doing 2 tests a week, so PCR testing, which is nose and throat swabbing, of all players, coaches and staff with player contact. And they've done thousands and thousands of these swabs now, and luckily nobody has been positive, which is fantastic. So basically what that means, and of course the players are in a fairly tight sort of isolation as well. They're allowed a few liberties, but they don't have the general liberties that we all have. So we've got basically quarantine players being tested twice a week. So we have this enormous level of certainty that there's no COVID-19 in the AFL. There is no need to quarantine them, talk about putting them into hubs, flying them interstate and quarantining them for 14 days because we know they're negative. 2 tests a week is beyond elite testing levels. So really what the AFL should do and what the state premiers should do is allow them exemptions. We should go back to a fly-in, fly-out normal AFL model with continuing this elite level testing and get the game back to some sort of normality, and then eventually we'll start to be able to get some crowds back. But we're not talking about stacking the ground like we would with a protest, but we're talking about maybe a small crowd allowed back in, well distanced, well controlled. So really that should be the next phase that we're looking at when the borders open up, or if they don't open up, then they get exemptions.
Dr Clay Golledge, appreciate your insights as always. Thanks for sharing your expertise with us. Appreciate it.
Thanks, Ash. Cheers.